Good Saturday morning, everyone. Today on Perspectives, we're talking about the 2019-2020 flu season. Some infectious doctors are calling this flu season one of the worst in decades. Since the official start of the flu season in late September, the flu is wreaking havoc on our health. Nearly 10 million Americans have gotten sick. Some 87,000 have been hospitalized. It has also gotten a lot more deadly in recent days. The Centers for Disease Control and Prevention estimates that another 1,900 people were killed nationally. Now that brings the total for the 2019-2020 season to 4,800. A total of 32 children have died. It could be a record-breaking season, a deadly one for children. Now, some experts say that it's on track to be the deadliest in recent history for all age groups. Now, take a look at this map. The green shows the minimal flu activity, with red as high. Watch now as the flu has spread across the United States since October. It is now widespread in 45 states, including Alabama. Flu season, though, is far from over, and health officials are saying that it's impossible right now to determine exactly how it will play out. The worst may be yet to come, but Mobile County health officials expect the flu to peak in February, but it can last as late as May. Here on the Gulf Coast, hospitals are extremely busy. Local emergency rooms are full. The Mobile County Health Department says that so far there have been more than 1,800 positive flu tests reported from area hospitals and at their clinics. Now, this time last year, that number was only 600. Nationally, health officials are calling 2019-2020 an unusual flu season. Fox News correspondent Marianne Rafferty has more.
We're only about halfway through this year's flu season, but the illness is already proving to be unusual. According to the Centers for Disease Control and Prevention, the main virus this year is influenza B, a strain that tends to affect children more than other age groups. It's the first time the B virus has predominated in the U.S. in nearly 30 years. As of January 4th, 32 children nationwide have died from influenza this season. That's twice the number of children who died by the same point in last year's flu season. While the B strain hits kids the hardest, its effects are less severe on the elderly. Because of that, the agency predicts there could be fewer deaths overall from the illness this year.
There's a lot of children ill and fewer elderly ill, which is why we're seeing high levels of illness and not such high levels of hospitalization and mortality.
Doctors are still trying to determine why this strain is harder on children. But for now, health experts are urging people to take steps to protect themselves and others. The best thing you can do? Get vaccinated.
The more people that vaccinate, the more effective it is to stop the virus, to stop the spread of the virus.
If you do experience flu-like symptoms such as coughing, fever, sore throat, or fatigue, the CDC says you should seek medical attention immediately.
Talk to your doctor about antiviral drugs that can make the duration of your illness shorter.
And it's not too late to get vaccinated. The CDC recommends the flu shot for everyone over the age of 6 months. Marianne Rafferty, Fox News.
And here with us this morning to share their perspectives about the current flu season, Dr. Wendy Murphy. She's an epidemiologist and director of the Bureau of Disease Surveillance and Environmental Services with the Mobile County Health Department. Dr. Benjamin Estrada, head of infectious disease for the USA Department of Pediatrics. He's also a professor and vice chair of pediatrics there at the University of South Alabama's College of Medicine. And Dr. Haiti Custodio. She specializes in pediatric infectious diseases as well, and also an assistant professor of pediatrics at the University of South Alabama College of Medicine. When we come back this morning, we'll hear from our local health experts and talk about the flu season in our area when Perspectives continues in just a moment. And welcome back to Perspectives. Our first guest this morning, Dr. Wendy Murphy. She's an epidemiologist and director of the Bureau of Disease and Surveillance and Environmental Services for the Mobile County Health Department. We thank you so much for being a part of this discussion today.
I'm glad to be here.
When we hear some of those kind of numbers and statistics and everything, and people will have a tendency to be afraid, but we don't need to be so, right? What is our area looking like when you talk about in comparison?
So in Mobile, currently about 8% of healthcare visits are for flu-like illness.
and that's above
8%.
8%.
Okay.
That's about the same as the state average and the national average at this time, but we've been experiencing elevated flu numbers for like 2.5 months now. So it usually doesn't start this early. We've been above the threshold of concern for going on 12 weeks, and so it's important to know that we're still looking out, and it's not too late to get vaccinated to protect you, because the flu season's not over yet.
And that's the part that a lot of people are worrying about when you hear we're talking February, just getting into that part of the season. Talk about why do you think we are where we are this early in the part of the 2019-2020 season?
So what's different about this flu season and why people are comparing it as maybe one of the worst from previous seasons is that influenza B, one of the flu strains that usually circulates, doesn't.
How many are they?
There are 4 and multiple versions of those.
Okay.
But usually, right now we have A and B circulating, but the B virus usually doesn't show up this early. We've been seeing B influenza circulating since October. Along with A, but we usually don't see it this early. Generally, B shows up in January, February, March, but we don't see as much of it. So those are the ones that affect young children and young adults more so. So as you heard, the Centers for Disease Control commented that that's probably why we're seeing elevated flu illnesses, but not as many hospitalizations as deaths as we fear.
Break that down for us, when those of us who hear these things about the different strains and the numbers, and what causes one to appear earlier in this type of environment? Is our weather with cold and hot, or what's happening?
Yeah, that's a really good question, and there's not a good answer, unfortunately. I think that we observe every flu season as it develops. We don't learn about how effective the flu vaccine is until we see what strains are circulating. It can relate to travel, it can relate to susceptibility, it can relate to many things, and so it's multifactorial. And it's really hard to say, but it's here, and we need to make sure that we're taking those prevention measures, getting vaccinated, covering your cough, and not covering your cough with your hand, because the flu virus can live on surfaces. If you touch a surface, it can live on that surface for up to 24 hours. That's
a long time.
It is. So, I don't want to cough in my hand and then shake yours, or touch an elevator button. I want to maybe cover my cough with my elbow or with a tissue. And then also you want to isolate yourself if you are sick. If you have a fever, acute onset of fever, body aches and pains, then you may have the flu. There's a very good chance of getting the flu, even if you got the flu shot, because there are some strains that the flu shot cannot cover. So if you are experiencing illness, stay at home, isolate yourself from family, coworkers, church members, that sort of thing, and call your doctor.
That's interesting when you talk about stay at home, because we just ran some information recently about most people do not stay at home. They will go to work, and only about, I think, 11% of the crowd will stay at home so they can get through that period and not be a spreader of diseases. So that's another thing of re-educating people to say that that's one of the best policies, is to stay at home, get out of the mainstream environment.
Exactly. And at this point in flu season, we're really emphasizing the addition of antiviral therapy to the prevention measures of vaccination and covering your cough and hand washing. So if you do get acutely ill and you have a relationship with a healthcare provider, you could call that provider, explain what you're experiencing, and that provider could potentially call in antiviral medications to your pharmacy so that you don't go into your doctor's office with flu-like symptoms and potentially spread it.
That's a very good point.
So the addition of antivirals is really important right now, particularly for people who are hospitalized and suspected of having flu, or if you're very young, very old, or have some other underlying conditions that might make you more susceptible. You might want to start antivirals, excuse me, very quickly, but talk with your doctor.
And when you hear about the percentages of the effectiveness of the vaccine, how do you respond to those to allay their fears about that and not say, well, it's 58%, so I still have what do you say to them?
The great thing about the flu vaccine is if you get vaccinated, and let's say you do get one of the rare strains that is not covered in the vaccine, it still can help you reduce the chance of complications from flu. So if you do get sick, it could
prevent severe complications, maybe prevent a hospitalization, or hopefully prevent deaths. So we do want people to still get vaccinated as we're learning more about how effective the flu vaccine matches the current strains. We do know, though, that the antivirals are 99% effective against the flus that are circulating this year. So a helpful tool in our arsenal for fighting flu.
And Dr. Murphy, right now, we are doing pretty good in our area compared to some of the stats that we're hearing from around the country.
Absolutely. So although we are at, a really high flu threshold for illness, the hospitalizations and deaths for flu this year are about the same as previous years. Nationally, there have been 32 pediatric deaths, as your broadcast mentioned. We've not had any pediatric deaths in Alabama and none in Mobile. Right. In the entire state, we've only had 3 flu-related deaths, and that is much lower than last year this time. It's not over. We still want to emphasize those prevention measures. We don't know if we're going to peak in late January or February. As you mentioned, flu season can continue on until early spring.
We thank you for being a part of this first segment. And of course, we're going to talk even more before we leave this morning on the program. Dr. Wendy Murphy with the Mobile Community Health Department, Mobile County Health Department, I should say. And after a short break this morning, we'll talk to 2 more of our local health experts about this unusual flu season when Perspectives continues. And welcome back to Perspectives on this Saturday morning. Dr. Benjamin Estrada, head of the infectious disease for the USA Department of Pediatrics. He joins us now along with Dr. Custodio. We're going to share more information as we're talking about our local situation here. Dr. Haiti Custodio, who also specializes in pediatric infectious disease. And we thank you both for being a part of this discussion today. We had some information that Dr. Murphy showed to give us an idea of what's going on here locally. What are you seeing through the USA system? Because you have one of the busiest, I understand, emergency rooms there at your children's and women's facility. So you are seeing a lot of people coming through in the course on a daily basis. What are we seeing here from your perspective?
Yes, we're seeing a significant amount of patients, pediatric patients with influenza B. Which is consistent with what Dr. Murphy described. The season this year began a little earlier than usual. Influenza B, which is the prevalent strain this year, it tends to affect and be more severe in children than in adults. The problem sometimes is that for children is not just influenza B what is the problem. It's also the complications that can happen after a child gets influenza B.
What are some of those?
The main complication that we fear is what we call a secondary infection. Children who have influenza B or influenza A can, within a few days after getting influenza B, develop a second illness caused by a bacterial organism like Staphylococcus aureus or strep.
So if we're seeing anything develop with our children, we need to respond immediately to this.
And one important thing to keep in mind is that sometimes children with influenza may get better for a few days and then they get sicker later. And that may mean that they have post-influenza bacterial pneumonia. And some people wonder, why does that happen? That happens a lot because all of us are colonized with bacteria normally in our nasopharynx, our mouth, our throat. As long as we're healthy, those bacteria don't do anything much. But when we get influenza, the influenza virus weakens the respiratory system defense, and that allows those bacterial organisms to come down to the lungs and cause pneumonia and more severe complications.
And we definitely don't want to have that pneumonia develop. Dr. Custodio, what are you saying to the parents who you're seeing in reference to being prepared to make sure the children are protected?
So what Dr. Estrada was saying, influenza is an infection and it sets the body up for another infection. So you know how we say love begets love? Unfortunately, that's the same thing for infections. Infections beget infections. And so what I try to tell parents is it's better to prevent having flu so that we can also prevent those infections that happen on top of flu. And that's why we advocate for vaccines. Is, you know, an ounce of prevention is better than a pound of cure.
And when you talk about the prevention aspect, as Dr. Murphy mentioned, if as an adult, you remove yourself from the environment, don't go to work, but for the children, we definitely want to remove them from the school environment.
Absolutely. And the younger children are the ones that are at highest risk of complications, specifically those younger than 2 years of age. We advocate for vaccination of children 6 months old or older. Some parents ask us, so what do? I have a brand new baby, a newborn, and we cannot give vaccine to that baby.
Right.
So the best way to protect those young infants is to make sure that everybody at home is protected, that everybody has had their immunization in order to protect those very young babies who have not had an immunization because they're not old enough, they're not 6 months old yet.
To be a part of the program. And so if you have other children in the midst of the newborns, and that's also another issue, right? You want to make sure that everybody, because the hands and the touching, the loving, as you mentioned, goes on, especially in those environments.
You share the love and you share the infection.
Yeah.
Sure. And the other issue is if a child is sick, especially if they have been diagnosed with influenza, they probably need to stay away from daycare and school activities. Someone who gets influenza can transmit the virus very effectively, at least for 3 days, all the way to 7 days.
Right.
So even if people start feeling better on day 3 or 4, they can transmit the virus to others up to an average of 7 days after beginning to get sick.
How do you tell if your child is in that process of developing the flu? Is there a way to tell in the early stages so you're not waiting until things are very noticeable? Is there anything that you can see and tell in the early stages of the flu development?
The flu usually starts like a regular cold, sneezing, coughing, red eyes. Interestingly, it is also associated with fever. Regular cold with associated fever. In older children, they may complain of chills, body aches. Those are symptoms that will point someone to think about flu, rather than just runny nose that we see sometimes with other conditions. Although flu can also cause, for some people who have who have built some defense, they can also get just a runny nose. So there's a wide spectrum of symptoms when it comes to influenza.
So this time of the year, you need to be very observant.
Yes, yes. And the other thing to remember about influenza, it can present just like any cold viruses, but some of the symptoms seem to be a little bit more amplified or stronger in severity. For example, kids might have higher fever. People affected might have headaches, more body aches, more exhaustion or fatigue. So that's what really sets influenza a little bit different than your regular cold viruses.
Right. Well, Dr. Estrada, Dr. Custodio, we're going to talk even more as we bring Dr. Murphy back in on our next segment here, because we want to give a final look as our local health experts give us some final thoughts about this, what we're calling an unusual flu season. We'll talk about it more when Perspectives continues. And welcome back to Perspectives. All three of our health experts are here with us now as we talk more about this unusual flu season. Of course, Dr. Murphy joins us again with Dr. Custodio and Dr. Estrada. One of the things that we needed to talk about was the treatment once we realize, or I guess before that step, the testing of making sure what's going on.
Yes. The flu can present with symptoms that are very similar to other conditions that are caused by viruses that produce cold symptoms. So it's always important, if possible, to try to determine whether the child or the patient has flu for sure. In order to do that, we have different types of testing, some of which is rapid testing, which can give us the results within just minutes. For patients who are hospitalized, who are really sick and who may be immunocompromised, we also have specific high technology molecular testing that can give us the result within a very short period of time, and it's going to be able to tell us whether it's influenza A, influenza B, or other viruses.
Okay, and so then the next step, of course, for treatment.
Yes, and as far as treatment, there are different antiviral drugs which are very effective. Some of those drugs are given by mouth. There is a drug that can be given by inhalation. And for patients who are really sick in the intensive care unit setting, who are not able to take anything by mouth, there is an IV medication, an IV antiviral that can be provided.
So several options.
Yes.
What's happening with the Mobile Community Health Department as we look at the different types of options for treatment? How many of those are available now?
Well, all of the antivirals are available, through normal practices, manufacturers. There's nothing in short supply or anything like that. So the important thing is that we try to start taking antivirals early, very early in illness, because that's when they can be most effective. I wanted to add just one note about the importance of the advanced testing for influenza, because that's how we know what's circulating in Mobile, around the country, and around the world. And those that information then feeds into the composition of next year's flu vaccine. So we really encourage providers to try to use that rapid test if it's helpful for you when the patient is in your office, but go ahead and process or request molecular testing so that we can get the information on what specifically is circulating around us.
And that's very important to know what strains we're dealing with.
Yes, I just want to add, in terms of testing, we do have rapid testing, as Dr. Estrada mentioned. Unfortunately, the sensitivity of that test may not be as good, meaning that even if the child has infection, sometimes the test can be negative. And in some instances, the physician may still elect to treat as if it is influenza, even though the test is negative, because of how the patient is presenting. There is an illness that we call influenza-like illness, meaning the patient presents the typical symptoms of influenza. You have the fever, cough, sore throat, and no other potential reason for those symptoms. And even if the test is negative or the patient did not get to be tested for one reason or another, some clinicians will elect to treat, especially if the person presents within 48 hours of onset of symptoms. 48 hours, giving the medication within 48 hours makes the medication most effective.
Well, a lot of great information that you all have shared today, and definitely some of the simple things that we can do as relates to our coughing and the direction. And the handshaking thing is something that I really have to work on, because I'm a handshaker. And so, you definitely now, that's right, doing the fist bump now and the elbow too.
Right.
So we thank you all three for sharing some great information. And of course, we've got information on how to contact our doctors with the Mobile County Health Department, along with the University of South Alabama, as well as the Children's and Women's Hospital as well. There are several ways to reach out, both on your social media platforms as well. We thank you so much, Dr. Estrada,
Thank you for
Castillo,
having us.
and Dr. Murphy for
It's been a
being with
pleasure.
us today here on Perspectives. And of course, join us here next Saturday morning for more topics as we discuss those important issues and seek solutions. Have a great week.